Imagine if your beloved cat or dog was in need of emergency veterinary care that involved a blood transfusion or perhaps plasma. Where would you go? Well, luckily, right here in York Region, the 404 Veterinary Emergency and Referral Hospital has a blood bank donation program to meet those needs. Certified veterinary technician Jerzy Kotlowski developed the blood bank program for the 404 Veterinary Hospital. And today, there are 54 canine donors and a handful of feline donors. But Jerzy states there's always need to grow that community.
And I have to tell you that the community, what we actually created, is the greatest people and donors we can ever imagine.
Pet owner Mark Malosh has brought in his 2 dogs to see if they will be suitable donors for the program. To qualify, a donor needs to be spay or neutered, have up-to-date shots, be over 25 kilos, be in perfect health, have no medical implants, and be on heartworm medication. A vet will then give them a full physical, and a blood test will be administered to see what type of blood the donor has.
The most popular and what we call the universal donor, we call them DEA4, is retracted from that pool, from the pool of negative dogs. And it's pretty rare, but it causes the least reaction what we can expect during the transfusion. This is test for one of your blood type, antigen. We call them dog erythrocyte antigen 1.1. If they would be present, there would be second line here. It's not present, it means the dog is DEA 1.1 negative. So that's what we're looking for. She's in the program.
Once in the program, a schedule is set up for the donor.
You know, the schedule is set up for 4 donations per year, but the dog can donate between 6 and 8 weeks. So it could be more intense sometimes, but we do have on board our, vets and our specialists that are looking very careful. And each donor, if it's in a crisis, if we even call the donor for emergency donation, the period must be like around 8 weeks, which gives you enough time to recuperate from the past donation.
The procedure to withdraw blood involves a physical exam by a vet. Then a catheter is carefully inserted into the vein to ensure no damage or hematoma will occur during the procedure. A needle is then attached and the blood can be safely withdrawn. The procedure lasts between 4 to 8 minutes, and a dog can give up to around 380 milliliters of blood. Once it's collected, it needs to be separated to extract its most important components.
Blood has 4 main components. So it's red blood cells, white blood cells, platelets, and the rest, the water, we can say is plasma. Plasma is a component, we can say like component like a soup, so maybe not, but has everything, has nutrients, has antibodies, has proteins, has sugar, has anything what your cell needs to be alive. So this product was already spun, so what we have to do, we have to retract plasma from red blood cells. For that reason, we have plasma separator. And that will create... Well, the most important are red blood cells, because red blood cells are the only component what can carry an oxygen. And in cases of a rapid blood loss or blood cell destruction, this is the only treatment that we can provide. We might not give that solution, but we're buying a time for the body to recuperate.
Blood can be stored for only up to 42 days, and plasma can be kept frozen for up to 1 year. But this means scheduling of donations is critical to meet demands and ensure that no donation goes unused.
It's really, really, really touchy for me, and it's very important. I'm very, very proud of the people and dedication what they have to our 404 blood bank.
If you have a pet that you think would be a good candidate for the donation program and you would like to participate, you can find out more information by visiting 404vet.com.